All right, everyone. I'm going to go ahead and get started. I'm sure a few people will be coming in here as we kind of get rolling. I am so glad that you guys could come to join us at kind of an odd time, 1 in the afternoon. We run these informational sessions and I try to pick a daytime and then an evening time and alternate. So certainly glad that you guys could make it here today. We are doing a nursing informational session, which is really for those that want to know kind of what's coming. Our plan is to just discuss what is the nursing program at HACC and what do we offer, what kinds of programs, what does class look like, what does clinical look like, what's the admission process look like, costs, all kinds of different things that hopefully you as a prospective nursing student would want to know. And I'm going to present that material through PowerPoint. I'm going to share my screen here in a minute. Mrs. Kazmi, who works for the college, did send you a copy of the PowerPoint. If you didn't get it, I'll put my email address in the chat and you can certainly send me an email and just let me know that you didn't get it and I'll make sure you get a copy of it. So everything that I'm sharing with you here today, I want you to have in the PowerPoint copy if you would like it, so that way you can reference back to it. We are also recording this session. And the reason we're doing that is so that we can post it to the web. And so other students who maybe couldn't make it today or just want to have this information can also watch it as well. So that's kind of our plan. It is a good solid 2 hours usually of material. I will certainly be pausing for questions and all of those kind of things. And we'll see how the flow is going if we take a quick couple-minute break. But I want you to know that if we don't end up taking a break, you are still welcome, of course, to step away to use the bathroom, to get a drink or any of that kind of stuff. Again, it's being recorded and I'm going to pause to let you guys ask questions quite often. So you'll get that opportunity as well. My name is Mark Lieb. I'm one of the directors of the nursing programs at HACC. I direct the Harrisburg campus. So HACC has 4 nursing campuses we're going to take a look at, and I do the directing on the Harrisburg campus. So this presentation, though, is not specific to the Harrisburg campus. I want you to know it is a generalized presentation that works for any campus. So you're not just hearing something for Harrisburg. If you're interested in Lancaster or York or something like that, this still works for you. Okay, so that's where we're headed. I want you to know that, like I said, we do have multiple campuses that the nursing program is offered on, but that's not how we treat it. The Harrisburg campus doesn't just do its own thing, and the Lancaster campus does its own thing. Yes, they have their unique faculty, and yes, they have their unique campus, but we are one nursing program. And so therefore, if you take a course on the Harrisburg campus, the content that you are receiving in that course is the same content that you would receive on the Lancaster course. It's just on a different campus, maybe taught by a different instructor, but the content is the same. And so therefore you are receiving the same education, regardless of what campus you attend, regardless of what you end up doing. So I just want you to know that it's one program, one school. It's just simply that we have it divided up into different campuses. Okay. So what is a nurse? Obviously, if you're here, you probably have an idea of what a nurse is, and maybe you have family members that have worked as nurses. Maybe you work as an aide in a hospital, and you've just decided you want to further your education, maybe because of COVID and everything that's going on. You've heard a lot of information on the news about nurses, and it's just intrigued you as to maybe something that you would like to do. Well, please know that nursing is a fantastic field to be in. I am a nurse as the director of the nursing program. I actually went to HACC as a student. So I've graduated from HACC's nursing program. And then I came back as an adjunct faculty teaching clinicals. And then I came back as a full-time faculty member. And now I'm the director. So I've been as a new student all the way up to this role here. And so I think nursing is a fantastic field to get into. It is challenging. It is heart-wrenching at times as you work with clients, and we know in these last couple of years how difficult it has been for nurses, but it's also a very rewarding field. And in terms of job security, in terms of all of those things, a fantastic field to get into. So know that in nursing, there are 2 general pathways to the title nurse. One pathway is the registered nurse, or RN, and to enter that type of job, There are 3 ways to do it. You can go to a diploma program, you can go to an associate degree program, or you can go to a bachelor's degree program. All 3 of those ultimately end up with the title RN. The licensure exam is the same regardless of which program you enter. HACC's program is an associate degree program. So you would earn an associate's degree at the end of that RN program. In addition to the RN pathway, there is a practical nurse pathway. And we're going to talk about the differences here in a second. The practical nurse is not a degree, it is a certificate. And you would earn a certificate at the end of the PN program. HACC offers a PN program as well. So you can enter as a PN or as an RN through education at HACC. Now, in terms of after your associate's degree or after your bachelor's degree, which many of our students choose to go on, there's lots of further educational opportunities. And you've heard about things like nurse practitioners, and those are in high demand right now. And there's a lot of different specialties you can get involved in. There's nurse anesthetists and nurse midwives. So there's a lot of different, and then nurse educators and other things. There's a lot of different fields that you can work in within nursing. You could do research, you could do non-patient care, or you could always stay directly at the bedside. So it's a very wide open horizon as a nurse. So we're going to look at the differences quickly between a registered nurse and a practical nurse. This is by no means an all-exhaustive list. But at the end of the day, the education required to become a PN is slightly different than the education required to be an RN. The PN is educated to do things more like coordinate care, have a little bit more limited scope of practice. They help to care for more stable patients, and they have more basic decision-making abilities within the care of the patient. And they always work underneath an RN and/or a physician. The RN has a higher level of education. There's more courses you need to take, more education you need to take, and the licensure exam is correspondingly a little more challenging than the licensure exam for the PN. And as an RN, you're going to more manage the care of patients. You have higher level responsibility. You care for unstable patients, critically ill patients. You initiate the plans of care and make decisions about the patient's plan of care. And your thinking is expected to be on a slightly higher level. And so there are some differences, but they're mainly related to the education involved and then the scope of what each does. But both has the title nurse, and both of them work in the care of patients. It's just that the roles are slightly different. In terms of either nursing pathway, it is a STEM profession, and as a STEM profession, it obviously needs a very high level of capability for its graduates. And so we really need to think about, do we have good reading skills? You're going to be reading patient charts. You're going to be reading information about, in nursing school, about different disease processes. You need to have a good biological science background, and some of those courses are required in the nursing program. So we're going to talk a little bit about that. You need a certain math proficiency. People love or hate math, but you do use math in nursing. You have to do dosage calculation. You have to make sure that what you're giving to the patient is safe. You are that last line giving the patient meds. And so you need to be able to calculate whether it's safe or not. You might be reconstituting, which means mixing certain medications. You need to be able to do that accurately, and you need good math skills to be able to do that. Computer skills are necessary because, of course, most of our charting, most of our electronic records are on computer. And so it is now requisite that you are able to work with computers in order to do most of your nursing jobs. There is critical thinking skills involved, which I mentioned. We treat you as somebody coming into the program that needs to develop critical thinking skills. Now, you may have great critical thinking skills for your own life, what to do about your kids or your family or job outside of nursing, but we're going to train you in nursing critical thinking. What does it mean to think critically like a nurse? And then you need to be able to communicate well, because you're going to be talking to patients. You're going to be talking to doctors. You're going to be talking to other healthcare providers. You need to be able to very accurately and coherently communicate so that you're understood and that you can understand them. In terms of the HACC program, I just want to go over real quickly. We're going to look at these in more detail, so don't worry, this is not all we're covering about the programs. But as I mentioned, there are 4 campuses that have nursing programs: the Harrisburg, the Gettysburg, the Lancaster, and the York. The one campus that does not offer a nursing program is the Lebanon campus. So you might be able to take some gen eds like English or something like that at Lebanon, but they don't offer a nursing program there, just the 4 other campuses. 3 of the campuses offer a PN program: Harrisburg, Lancaster, and York. As you can see, our Gettysburg program does not currently offer practical nursing. So if you live in the Gettysburg area but are interested in practical nursing, you're going to have to do a little bit of driving to get to those. The other 3 campuses do offer that. We offer, go ahead.
You are connected to computer audio.
Okay, sorry. So the ASN program is our Associate of Science degree program, or our RN program. And remember, I said it's an associate's degree program. And as an associate's degree program, that's the degree you're going to earn at the end of an Associate of Science in Nursing. But you can think of it as our RN program because that's the job you're going to have once you graduate and pass your licensure. So we offer a variety of different types of programs to become an RN. The education is the same within each of these programs, the courses, the requirements. What's different is how the content is delivered in terms of timing, 4 versus 8 semesters, and in terms of time of day and day of the week, day versus evening or weekend or so on. But the actual education and the progression of the courses is all the same in all of these options. It's just different ways of delivering it to the student so that it works with your life and schedule. So we have a traditional option, and we're going to look again at these in more detail. Harrisburg, Gettysburg, and Lancaster offer the traditional option. It's 4 semesters. York offers an 8-semester day-only option. So this is day only, day classes, day clinical, right? We also offer an evening-only option over 8 semesters. All 4 of our campuses offer an evening-only option. And then only Harrisburg currently offers a weekend option. 4 semesters, everything takes place basically on the weekend. And again, I'll look at all of these in a little more detail in just a little bit. So what does class look like in a nursing program? Well, what you need to understand about class in a nursing program is that it is not like you're hearing right now, which is just straight lecture. I'm talking to you, you're listening to me, maybe taking notes, and that's really all the input you have. In terms of actual nursing program classes, what we do is we have a flipped classroom environment, which means that you are expected to do some work ahead of time. You are expected to have some ability to prepare for class. And then once you've done all the preparation for class, you come to class and the educator is going to spend some time lecturing, but a lot of time doing in-classroom activities, case studies, discussions, group work, putting the pieces together for the things that you've already learned. And so it's more of a mixed model than just straight lecture. In terms of how we teach the program, both the PN and the RN are based on concepts. It means that we are teaching you ideas that are important to nursing instead of just strictly diagnoses, which means when I learned nursing, they taught me all these different diagnoses like pneumonia and heart attack and stroke and then everything about those, and then everything I needed to know and all the meds and all the treatments, and you just kind of memorized all these different medical problems. That's not particularly helpful for nurses. It's a great way to educate doctors because they need to make diagnoses and they need to make treatments and order meds and on, but that's not a great way to educate nurses. So what we have found is the concept-based model is a much better way to educate nurses. It teaches much broader concepts and then starts to apply them to specific diagnoses. So what I mean by that is we're going to teach you about perfusion, and perfusion is a concept. And we're going to teach you, how do you know your patient is having good perfusion? How do you assess perfusion? How do you know if your patient is having bad perfusion? What assessment is going to point to that? And then if your patient is having bad perfusion, what do you do about it? How do you fix perfusion? How do you treat it? And so by learning about perfusion, then we can start applying it to different disease processes. If a patient has poor perfusion because of a bad heart rhythm, that's going to look the same as a patient who's having poor perfusion because of a stroke, or because of a myocardial infarction, or because of a blocked blood vessel. So you start to learn that perfusion can be applied to a lot of different diagnoses. And yes, we're going to teach you about some of those diagnoses, but more important is that you understand perfusion. Then you can take it anywhere that you see a patient having bad perfusion. So that's the idea of a concept-based curriculum. And we do have sim labs on all 4 of our campuses. They offer a variety of different mannequins, from just static mannequins that you might do a dressing change on or something like that, all the way up to high fidelity mannequins that bleed and have blood pressures and talk, and you can care for directly, put IVs in, and all these types of things. So we utilize all different types of simulation throughout the program to help give you additional learning opportunities over and above just the theory classroom. Now, as it comes to clinical, we do have clinical experiences. And so the clinical experiences are in the hospital, in facilities like outpatient centers or cancer centers or prisons or schools, or all different opportunities for clinical experiences where you are working face-to-face with a patient and you're caring for that patient like a nurse would. You're giving medications, you're doing treatments, you're doing procedures, you're assessing, you're documenting, you're charting. All of this is to do the work of a nurse as a nursing student. That's what those clinical experiences are. And you'll have those all throughout the program. And as I said, we also use the clinical lab. The clinical lab is to build your skills. It's to do simulations. It's to make sure that you feel comfortable in a safe environment before you go out and practice at the bedside. So what about remote learning? What's going to be different and those kind of things? Well, so here's where we stand right now based on what HACC has presented. And again, this is always subject to change based upon needs, but we are moving towards a return to campus. And so the goal is this summer, we will have nursing courses back on campus. And certainly by fall, if nothing changes, it is likely that all of our nursing courses will be offered on campus. And so we will no longer be in a remote learning environment come summer and certainly by fall. So if everything moves as expected, we will no longer have remote learning, meaning these Zoom sessions where we have class. Right now in the spring, class is still Zoom for the most part, and then your clinical experiences are face-to-face, meaning you're going to the hospitals and you're caring for patients directly. There are some courses that are back on campus for the spring. Our skills courses are back on campus, meaning the ones that you work on the lab and you develop skills like how to assess a patient and how to do a dressing change on a patient and how to put a Foley catheter in a patient. Those are all on campus already. Our goal is to continue to add on campus courses so that you will have more and more face-to-face classroom experiences to mirror what was happening before the COVID crisis happened. Again, that's subject to change, but as of now, spring is still remote. Summer and fall are planned to be back to campus. So if you're thinking of trying to get into a program this summer or fall, most likely you will find all of your courses are back on campus for summer or fall in terms of nursing courses. I'm going to pause here for a second. Anyone have any questions about what I've presented up to this point? Remember, I'm going to go into more detail about the programs and timing and all of that in just a little bit, but anything kind of pique your interest up to this point you need to know about? Okay. Well, then what I'm going to do is I'm going to shift into the practical nursing, and I'm going to talk a little bit about that program first, and then we'll do the registered nursing after. So practical nursing, again, as I already kind of alluded to, has basic nursing care. They work under the direction of RNs and doctors. Please know that as a PN, you can work in a wide variety of healthcare institutions. You can work in hospitals, you can work in emergency departments, you can work in ICUs, you can work in prisons, you can work in outpatient centers. There's no limit to where you can work pretty much as a practical nurse. So it is a high demand job right now. Most facilities are hiring LPNs, and so it is a very great way to get into nursing practice. You have a relatively good earning potential right now. It's going to be even higher than this right now. This is based on mostly pre-pandemic numbers. We know that they are paying more right now. We're hoping that that stays after the fact, but based on pre-pandemic numbers, new graduates were earning about $46,000 a year. And obviously that can only go up from there. In terms of HACC's PN program, why might you consider us? Because there are other local PN programs besides HACC. I would say it's a great program for a variety of reasons. One reason being we have the highest NCLEX pass rates in the state. Once you finish nursing education, so you finish HACC, you're not automatically an LPN or an RN. You have to take a licensure exam. And that licensure exam is a nationwide exam. All graduates of all of these programs have to take it. And you have to pass the licensure exam. And until you pass the licensure exam, you can't practice as an LPN or an RN. So it's like that final proof before you're able to go out and start practicing. It's similar to what they do for people who take the bar after law school, or the doctors who have to take their boards before they become a doctor. You as a nurse need to take your boards before you're able to start practicing. We have the highest NCLEX PN pass rates in the state, which means that if you go through our HACC program, your chances of passing NCLEX, especially on the first try, are nearly 100%. We're almost at 100%. It's a 15-month concept-based program. So it takes 4 semesters. All PN programs on all 3 of the campuses that offer it, remember Gettysburg does not, they all start in fall. So the PN program is only a fall start, no matter what campus you attend. And it has a fall semester, spring semester, summer semester, and a second fall semester. So you start one fall and you graduate the following fall in December. So it takes 15 months to finish. It is completely integrated into the RN program, which means if you graduate from HACC's PN program and you decide to go on to your RN through HACC, every class you take in the PN program will directly translate into something in the RN program that we give you credit for, so that you limit how long it takes you to finish your RN program. You're able to go from HACC's PN to HACC's RN smooth and seamlessly, and all you need to graduate your RN is 4 nursing classes and 4 gen eds, which maybe some of you have done already. But it's a very easy transition from HACC's PN to RN. So another reason to consider the PN program. So students that are coming in new to the PN program, the next time we're going to accept students is in August of 2022, and they will graduate in December of 2023. Please hear me on this. The PN program is a very time-intensive program. Other than the very first fall, you will have the PN program running 4 to 5 days a week. And those clinical days will be about 7 to 8 to 9 hours. And those classroom days could be 3 hours in the fall and in the spring. And in the summer, they're 8-hour class days. So it is 4 to 5 days a week, approximately 24 to about 35 hours a week. So you're committing to a lot of time in the PN program. You have to evaluate your life and your home life and your work life to determine whether you can make that commitment or not. You can see that class varies by day depending on the campus and the semester, but it is always a daytime class. So it's always going to be between the hours of about 8 a.m. and about 4 p.m. It is a daytime class, regardless of the semester or campus. And then in the summer, class is all day on a Monday from about 8:30 a.m. till about 4 p.m. Clinical is 3 days a week. In the fall, the first fall, you have no clinical. That's why your time is down a little bit in terms of commitment. But in all 3 of the other semesters, clinical is 3 days a week. In spring and fall, it's Monday, Wednesday, Friday. In summer, it's Tuesday, Wednesday, Thursday. So in the summer, you're going to class all day on Monday and clinical Tuesday, Wednesday, Thursday for about 7 to 9 hours. So it is a very time-intensive program. I just want you to be aware of that. Clinical can happen during the day hours, or they can happen during the evening hours. Clinical is not a day only or a evening only component. It is both day and evening at different times, depending on what clinical you're attending. Now, here's kind of what the progression looks like, the sequencing looks like. I want to point out that the one course in each of these examples that you will have to take and finish successfully prior to any nursing courses. You cannot take any of the nursing courses until you have finished Biology 121. Now, that doesn't mean you have to have finished Biology 121 before applying. But if you apply and are accepted, you have to finish it before you get into those nursing courses. So for our fall start, that means you must have taken it and passed it by the end of summer. If you cannot take and pass it by the end of summer, you will not be able to start in fall along with everybody else. Your acceptance will be rescinded. So just know that that Biology 121, which is A&P1, is critical to being sure it is done prior to the nursing courses. It will keep you from starting nursing, even if you've already been accepted. The other gen eds are highlighted in blue here. They can be taken anytime with the exception of Biology 221. Biology 221, which is microbiology, must be taken prior to the summer semester. So you could take it in the fall, you could take it in the spring like it's shown here, or if you already have it done, you don't need to worry about it, but it must be taken prior to the summer semester. If you do not have it finished successfully before summer, you will not be able to move into summer, okay? So your two biologies do have prerequisites in terms of making sure you're able to enter certain points along the program. Those courses in black are the practical nursing courses. Those are a sequential, meaning that they must be taken in order. They are also not movable. That simply means you cannot say, oh, well, I see we only have 3 practical nursing courses in the fall. Can't I add a few of these into fall and get done sooner? The answer is no. The nursing program follows very specific sequencing, and this is the only way that you can take the practical nursing courses. These are only offered in the fall. These are only offered in the spring. These are only offered in the summer, and so on. So there's no way to move the practical nursing courses around. Those are locked in. It's the gen eds that you have the flexibility with. Any questions about any of this that I presented up to this point?
I did have a question. With the gen eds, do you have a certain amount of like years that they have to be, like if it's older than so many?
Yeah, that's a great question. The answer is no. You may have heard that at some point we had a 7-year rule on our sciences, which was true. About 18 months ago, we eliminated that rule. So if you've ever taken these in the past, and they can be transferred into HACC or they were taken at HACC, then you can gain credit for them and not have to retake them. There's no timeout rule for any of the gen eds. Any other questions? Okay. So why would a student consider our LPN to RN option? So you go to the PN program, and again, I said one of the beautiful things is it's completely stackable. Well, one thing to think about, and this is true of some of our students, I just got an email from one of our students or one of our potential students today that said she's having a really hard time with TEAS, just cannot get the score that she wants or needs on TEAS. And did I have any advice? And was there any other options? Well, this is something to think about. If you're one of those students who just cannot score the needed score on T's for the RN program, which we'll talk about, it has to be 70 or higher. Maybe you're always in the 60s. Well, don't fear. If you're willing to, you can enter the LPN program with a score in the 60s. And then you can progress through the LPN program and graduate, and then come back to the RN program. Isn't that great? You don't have to score the 70 initially to start nursing. And then once you finish the PN program, most of our students are then very easily able to score the 70 because of all the education and the knowledge they gained in the LPN program. And then they can come right back into the RN program and finish out their RN, where they maybe couldn't have done that before the PN program. So if you're one of those students who struggles in T's and you're scoring in the 60s and you're thinking all your dreams of becoming a nurse are over, it's not. Consider the PN program. It is a great pathway that will likely be able to lead you into that RN dream if that's what you want to do. It also, because of our PN to RN acceptance, it can help you to graduate quickly. And while you're finishing your RN, you're working as an LPN. And so now you're working in the hospital as an LPN, gaining LPN nursing experience, giving meds, assessing patients, doing the things that nurses do, procedures. And then you come into the RN and you're working as an LPN, making LPN wages and still able to do the RN program. And so it's a very great way to gain that experience and that higher pay while working in the RN as well. So just some things to think about if you've never really considered the PN program. It's a great pathway not only to nursing, but also then to the RN if that's something that is your ultimate goal. So when you do come back as an LPN from the HACC program into the RN program, like I said, this just gives you an example. There are 2 nursing courses you take in one semester and 2 nursing courses you take in another semester, and you are finished. And so 4 nursing courses, as well as the 4 gen eds that are not taken in the LPN program. The 2nd English, the 2nd Anatomy Physiology, mathematics, and an elective. So 4 gen eds, 4 RN program courses, and you finish your RN through HACC after finishing your PN through HACC. Okay, so there is ways that you can come back and finish quickly with your RN once you've gotten your LPN. What about some of you might be current LPNs and you graduated from our nursing program, but it's not the new nursing program, or you're an LPN from another program. So do you gain any benefit from coming into HACC's RN program? And the answer is yes. So whether you're an old graduate, 2019 or earlier from HACC, or you are an LPN from another program, we're still going to give you advanced standing status. And what that means is that there are certain courses in the RN program that we will automatically give you credit for. So you won't have to take, because you've already taken something similar in an LPN program and demonstrated that you've done it. In addition to those automatic courses that we're going to give you credit for, we're also going to give you the opportunity to test out 4 additional courses. And those 4 additional courses are worth 12.5 credits. So those are 4 courses you will not need to take in the RN program if you successfully test out. And the test out is just a way of demonstrating your competency and knowledge of those areas. If you can pass the test we give you, you get a credit and you don't have to take those courses. So not only are you going to gain automatic credit, but you're also going to have the opportunity to test out of more courses. That's true of any LPN that is coming into our program that's either been an old graduate of HACC's LPN program or a current LPN from somewhere else. Their progression looks like this. Remember how I said you have some automatic courses? They're missing courses up here because of the fact that you automatically gain credit. So there's only 2 140 level courses you need to take instead of 5. And then if you are able to successfully pass out of the 150 course, that's one of our major med-surg courses, you can see it's 5 credits. If you're able to successfully pass out of that 150 course, in some of our programs, that will allow you to shorten your RN education into 3 semesters, just 3 nursing course semesters instead of 4. So in most of our cases, it's going to be 3 or 4 semesters to finish the RN, even as a current LPN. As long as you can test out of those courses, it just gives you less credits you have to take. Okay, so again, there's a pathway for you if you're an LPN and you want to come back into HACC's RN program. Any questions about anything I've discussed about PN or before I jump into the RN section?
What is the application deadline for the PN program?
I've got that in about 20 slides. Hang on, I'm going to go through all the deadlines in a little bit.
Okay.
Anybody else?
Yeah, sorry. Do you still have information in regards to the T's?
I do have a little bit of information on the T's I'll get to in a little bit also.
How are grades calculated in the LPN program?
So grades are on a grading scale, obviously from 0 to 100 and A, B, C, D, F, just like the college. The LPN program is the same grading scale as the college. So a 70% or higher of the total points is needed to pass a course.
And one last question.
Mhm.
For the LPN program, when you do the bridge
Mhm.
from LPN to RN,
Mhm.
can that be completed online or does it have to be in class?
It's in class. It follows the normal classes. So if our currently they're doing classes remotely, just like our other RN students are, but it's not, there's no online only option. It's going to be class and it's going to be clinical in whatever format that is currently being used at that time.
Okay. And is there tutoring available?
Yeah, if you go to HACC and you type in search in the search box tutoring, it'll take you to the HACC tutoring webpage. They can tutor you about T's. We have nursing tutors. There's tutoring available for all different areas.
Okay, that was my last question. Thank you.
Yeah, no problem. So the RN program, now we're going to look at some of those programs. An RN, as I've discussed, kind of has a higher level of responsibility than the PN. Again, there's a wide variety of areas that RNs work in. Their earning potential is higher simply because, again, they have a higher level of responsibility and higher level of education. Their earning potential increases if you increase your education. If you go on for your bachelor's degree and then for your master's degree, you can earn a lot of money as an RN practicing in some of those areas. As a rural nurse, anesthetists are our highest paid nursing profession. They can easily make $150,000 to $200,000 a year without much difficulty. So again, as you further your education and further your knowledge, you can also further your paycheck. What about HACC's RN program? Any thoughts about it? Well, I will let you know, and this is absolutely true, we are one of the most highly sought after nursing programs in the state. We have a lot of local facilities to us, Penn State and UPMC and Geisinger and other ones, and they all routinely tell us that when they have a HACC graduate versus another graduate side by side in the interview process, most often they will hire the HACC graduate if everything else is equal. And that's because they know the level of education and expertise and training that that HACC graduate has received. So you will be sought after as a HACC graduate in nursing. We have high NCLEX pass rates in the RN, not as high as the PN program, but we still have high NCLEX RN pass rates. It's a concept-based program, just like I mentioned. Our students are leaders in many of our area hospitals. We have CNOs, which are chief nursing officers in hospitals right now that are HACC graduates. So there are plenty of HACC graduates locally that know the value of the education of the HACC program, and they are happy to see those graduates working in their facilities. What about the time commitment? Now we're going to go through the individual programs in a little bit more detail. I'm going to start with the traditional program. Remember, the traditional program is offered on Gettysburg, it is offered on Lancaster, and it is offered on Harrisburg Campus. The York campus does not offer this program. The traditional program utilizes fall and spring semesters only. You have your summers off from nursing courses. So in the traditional program, its progression cannot offer you any summer nursing courses. Class is approximately 2 to 3 days a week, and time varies. It can be in the morning, it can be in the afternoon, but it is typically during the day hours. Clinical is 2 days a week in the traditional program. It varies based on campus, but on the Harrisburg campus, about 95% of our traditional clinical experiences are on Tuesday and Thursday. So Tuesday and Thursdays are our primary clinical days on the Harrisburg campus. Now, please note that in the traditional program, while your class is during the day, your clinical could be day or evening. It is not a day-only program. There is no such thing in the 4-semester program as a day-only program. Clinical could be days, clinical could be evenings. Class will always be during the day. Here's the progression starting with this fall in the traditional program. It's the next time that we will be accepting students into this traditional program will be for the fall start. You can see again that we have our nursing courses highlighted in black. In the traditional program, and when you are accepted into a program and a campus. So if you are accepted into the traditional program, this is the sequencing of your nursing courses. They're not alterable, okay? So you would take your nursing 140s in the fall, your 150s in the spring, your 240s the following fall, and you would graduate in May of 2024. Remember, you have your summer semester off of nursing courses. It's a great time to be able to get some of your gen eds done. You can see here that Biology 121 is a requirement to start your nursing courses. Just like in the PN program, you cannot enter these nursing courses in fall until you have taken and passed A&P 1. So you can apply to start in fall without having taken and passed Biology 121, but you'll have to finish it successfully before fall in order to be able to start if you're accepted. I want to point out Biology 122, which is your A&P 2, has to be taken before your 150 classes. So if you haven't taken it, you need to think about your timing of A&P 1 and 2, because A&P 1 has to be done before these courses, and A&P 2 has to be done before these courses. So you'll be likely taking it in the summer and fall if you haven't taken either one yet. The final one is Biology 221, and that must be taken before this Nursing 250, the last semester. Now, obviously, you have a lot more time for this one because you have your summer semester, your fall semester, there's more time to get that one in. But each of your biology courses are prerequisites to certain portions within the nursing program. Your other gen eds can be taken at any point as long as they're finished so that you can graduate on time. Any questions about the sequencing of the traditional program or the class days and times?
Yeah, I have a question. So can you take the bio 121 like in the fall semester as well as the nursing classes?
The answer is no.
No.
It
Okay.
must be taken prior to the nursing courses. So it can't be taken concurrently with. You cannot take any nursing courses without having that finished with a grade in the book. Any other questions?
For microbiology, so it just has to be taken before summer 23?
It has to be taken before spring of 24 in this case.
Oh, okay.
See how it's got to be taken prior to nursing 250. So in this case, spring of 24 is when nursing 250 is. So as long as it's taken any time before that semester, you're fine.
Okay.
This is for example's sake that I put it in the summer semester. It could be taken in any of the semesters. It doesn't have to be that semester. The only ones that aren't movable are the black ones. The rest of them are movable. Any other questions about that? So now we're going to look at the 8 semester day program. Now this is the only day only option. So if you are fundamentally a student who cannot take evening class or evening clinical for whatever reason, this is the only program HACC offers that will meet that criteria. And it is offered at the York campus only. All right. It includes summer semesters. So this one is a summer program as well as a fall and spring program. Class is 1 to 2 days a week. Class will be during the daytime, and clinical is during the weekend, and it is during the daytime as well. So it has a day of the week class and then a weekend clinical component. So that is how the York campus 8 semester works. It is day only, both class and clinical. Now, all of our campuses, all 4 of them, offer evening option programs. It takes 8 semesters to finish. They include summers, and it is a true evening only program. And what that means is class will never start before 4 p.m. and clinical will never start before 4 p.m. So remember, if you're accepted into an evening option program, then you will always have class at 4 p.m. or after and clinical at 4 p.m. or after. Class is 1 day a week typically, except in the first semester where it's 2, but typically 1 day a week. And clinical is 1 day a week. So it is a 2 day a week commitment. It is during Monday to Friday. There's no weekend in the evening program. So Monday to Friday, 1 day a week of class, 1 day a week of clinical, always 4 p.m. or after. Here's the progression for the 8 semesters. This would be the day or the evening. The progression is in your first semester. There are 3 nursing courses you take, and then so on and so forth throughout the program until you finish in your 8th semester. They utilize summer semesters. And so therefore, as you count them, you would count from when you started until you ended, including summer. So let's just say as an example, you started in the fall. It would be fall, spring, summer, fall, spring, summer, fall, spring. And so you would graduate in a spring semester, right? 8 semesters after you started. Again, no change in the requirements. Biology 121 must be taken prior to entrance into the nursing courses. Biology 122 must be taken prior to your nursing 150 course. The only difference is in this case, your 150 is offered in the 3rd semester instead of the 2nd, because again, it takes 8 semesters to finish instead of 4. The blue ones are movable and the black ones don't move if you're accepted into the evening program. One thing I do want to point out unique to the 8 semester programs is that if you are a student who utilizes and is dependent upon financial aid to help pay for classes, based on federal guidelines, you do not start receiving any level of financial aid until you are taking 6 credits in a semester. 6 credits to 12 credits gives you, or 6 to 11 basically, gives you part-time financial aid. 12 or more gives you full-time financial aid, but you don't receive any financial aid till you get to 6. I just want to point out, please take a look at the credit totals of these black courses. These black courses in the parentheses show the credits of each of these nursing courses. There is not a single semester in the 8 semesters where you will ever achieve 6 credits with just nursing courses. So if you are dependent upon financial aid, you have to make sure that you are adding your gen eds slowly throughout the program in order to achieve the 6 credits or more needed for financial aid. If you've already taken all of your gen eds and you try to enter the 8 semester program needing financial aid, it is going to be very difficult because you never achieve the 6 credits by itself. Any questions about the 8 semester program, the timing, financial aid, anything like that? Now we'll talk about the weekend. The weekend program is offered on the Harrisburg campus only. It is a 4-semester program. However, it is unlike the 4-semester traditional program in that it uses the summer. So it is 4 consecutive semesters, just like the PN program. You start in a fall, then you go spring, summer, and graduate the following fall, okay? In the weekend program, class is 1 day a week. It is Fridays in the fall and spring semester, and it is Thursdays in the summer. The reason for that is the college is closed on Fridays in the summer. And because the college is closed, we can't hold classes. So Friday classes in fall and spring, Thursday classes in the summer. Clinical will fall on Saturdays and/or Sundays. Some of the semesters, particularly the first one, it is Saturday only. So Friday class, Saturday clinical. Once you move into the second semester, the spring semester, it becomes Friday class and Saturday and Sunday clinical, and then it remains Saturday and Sunday clinical for the remainder of the program. Okay, that means every Saturday, Sunday, during those times, you would have clinical. Class is during the day hours from about 8 to 9 a.m. to about 3 to 4 p.m. It is a solid 6 to 8 hours of class. Now you do get a lunch break and breaks in there, but it is a solid 6 to 8 hours of class. You then have, of course, clinical experiences on the weekend that can be day or evening clinical experiences. So again, the weekend program is not a day only thing. It is a day class, but a day or evening clinical, okay? Progression of it is as we see it. One of the questions in chat was, is this RN only? And the answer is yes, it is RN only. There is no weekend PN program, only a weekend RN offering. You can see here, Biology 121 must be taken prior to any nursing courses. Biology 122 must be taken before your 150 courses, and your Biology 221 must be taken before your Nursing 250 courses. You can see here that you go fall, spring, summer now. Instead of having summer off, you go in summer, and then you go to fall again and you graduate in December. So that's the progression of the weekend program. Any questions about it?
Yeah, I have another question. What is the class Math 202?
Math 202 is statistics. Math 103 is college algebra. So in the nursing program, we will accept either math as your math credit for the program.
I have a question.
Mhm.
What the other girl just said, I was wondering, is there one that you guys prefer more than the other of the math?
Yes, we would like you to take statistics.
Okay.
And that's not because we want you to take the 4-credit course over the 3-credit course. There's a reason behind it. And the reason behind it is many of our students choose to go on for a bachelor's in science degree.
Okay.
A lot of our facilities want that, and some of them have worked it into your contract language that you have to get it within a certain amount of time, 4 years or 5 years or something like that. So many of you that would graduate are going to go on for your bachelor's degree. Well, one of the things that is true of almost every single bachelor's degree program you will find is that they require statistics. And so if you're going to need to take statistics for your BSN, the beautiful thing is most of those programs will allow you to transfer in your HACC statistics and not have to take it again.
Okay.
So you're saving yourself money by taking the statistics now instead of in your bachelor's program later. But that's the only reason, because it could save you from having to pay for a math course twice.
Thank you for answering that.
Yeah, of course.
I have a follow-up question on that.
Yep.
So I'm finishing my bachelor's degree right now. So I already took a stats class. Would that transfer over to HACC?
Yep. So what you'll do is once you finish your program and you get your official transcript sent over to HACC, our records department processes those transcripts. They look for, of course, corresponding courses to give you credit for, and they'll assign credit for all of those things that cross over. And so if it's a statistics class and it's a 4-credit statistics class, like our 4-credit statistics class, they'll give you credit for it and you won't need to retake it.
Thanks so much.
Yeah, of course. So what about the cost? Well, I'm not going to spend time linking out to it now, but again, Mrs. Casme sent you this PowerPoint. So these are all clickable links. This will take you out to directly to a PDF document that breaks down the costs of both the RN and the PN program. It shows you things like course fees. It shows you things like equipment and uniforms. It shows you things like tuition, computer-based fees like ATI and other things. So there's lots of fees that are out there that are documented. I just want you to know you can click on that and you can go to it and you can see exactly what the cost breakdown is. Most of the cost of the program, other than tuition and course fees, is upfront cost. You pay for it in your first semester with your books and your uniform and so on. And then you don't need to pay for it again. We utilize the same books throughout the entirety of the program. We don't ask you to buy new books later on. Our RN and our PN program use exactly the same books. So if you buy them for the PN, you don't need to buy them again for the RN. So again, most of that cost is in the front. And once you've paid it, you've basically paid for almost everything you need to buy throughout the entirety of the program. We're going to look at the requirements for admission now, both PN and RN. So somebody mentioned the T's. For those that have not heard the T's, and I would be surprised if any of you haven't based on being here, the T's is a test to determine your basic competency in math, English, and science. Kind of like the ACTs, which of course, if you took, or the SATs, you know how much you hated those things. This is very similar, okay? What it does is it looks at reading, math, and science, and English and says, how good are you at each of these areas? I want you to know that the TEAS exam is a national exam. It's not a HACC exam. We don't write it, all right? It is utilized by not just HACC's nursing program. Our dental hygiene uses it, as well as some other healthcare careers here. And it's also used by all kinds of nursing programs and health career programs across the country. So it is a very established test. The reason we use it is because statistics have shown students who do well on TEAS do well in health career programs. Specifically for what we care about, it shows that they do well in nursing programs. We want students who apply and are accepted to be successful. We don't want you to apply and be accepted and not be able to finish the program, because nursing school is hard. It is hard. It really is hard. So if that's the case, we don't want you to start and then not be able to finish. And now suddenly you've got all these nursing credits to pay for that didn't do you any good. We want students who start the program to be able to successfully finish the program. Well, the TEAS exam has been proven to show that students who do well on TEAS historically do well in nursing programs, and students who don't do well on TEAS don't necessarily do well in nursing programs. And so because of that, we use it as our admission test to determine whether you're able to apply to the program or not. For the RN program, our cutoff is 70 or higher. You must score a 70 or higher on the TEAS to be able to apply to the RN program. For the PN program, it is 60 or higher. So the PN needs a lower T score to apply than the RN does. There is a clickable link here to take you out to some more TEAS info. It takes you right to the TEAS posting page, and it gives you all kinds of information about the TEAS. There is tutoring available for the TEAS through HACC. There are study sessions that are available through HACC. There's a brand new how to take the TEAS video that somebody put out through HACC that gives you ideas and tips and hints on how to better your TEAS score. So HACC offers a lot of free to you reference materials and resources to help you do well on TEAS. There's these sessions that I mentioned. There's 2 still coming in April. This information is obviously in the PowerPoint. It's out on the TEAS website as well, but there is a specific session they're holding in April where you can go about test strategies and approaches and all of those kind of things. So use that. That's being given to you free of charge. I want you to note that in T's world, there are two current versions out. There is a version 6 and a version 7, okay? As it stands right now during this time frame, you may take either. We will accept either version 6 or 7, all right? Until next fall, beginning in the fall of 2023, not this coming fall, but the following fall, we will then only be accepting version 7. So for the next several admission cycles, we will be accepting 6 or 7. If you're wondering what's the differences between 6 and 7, here it is. 6 has a little bit more reading questions and a little bit more science questions, and 7 has a little bit more English language questions and a little bit more math questions. The big difference is 7 has added chemistry. There aren't chemistry questions on 6, but there are chemistry questions on 7. So if you like chemistry and you're good at chemistry, maybe you want to consider 7 because you will do well on those 8 questions. If you're not so hot on chemistry, you might want to consider 6, but that's up to you. We'll take 6 or 7 at this point. Again, if you are taking the T's, I just want you to know that you can take the T's through HACC. They have information out on the T's website about how to do that. It is a computer-based test. You can come to campus to take the T's, but if you are taking it from a remote session, just know that the T's exam requires a laptop or a desktop. You cannot take the T's exam with an iPad, an iPhone, a tablet, because the ATI, who's the company who gives the T's, does not allow those platforms for testing. So you must have an actual computer to take the T's test. But what if you don't have access to a computer? Well, like I said, they are now offering on-campus testing for T's, but in addition to that, you can also request to loan or borrow a PC from HACC if you're a HACC student. And you can just click on this link, complete the application, and the library will work with you to get you a computer that you can borrow for testing or for the semester so that you're able to utilize it and take the T's. We want you to not have any barriers to you being successful with this. So when can I apply to the PN program? Well, just ask yourself some of these questions. Have you already graduated, or will you graduate high school before the fall semester? Will you be 18 before the fall semester? Did you complete or will you complete that Biology 121 by the start of nursing courses? Again, you have to have it done by fall. Do you have a T-score of at least 60? Is your overall HACC GPA 2.5 or higher? That's a requirement for application. If the answer is yes to all of those, including if you're transferring, but basically if you can answer yes to those top questions, you are able to apply to the PN program. You're ready to apply. Our scoring for admission is based on only 2 things. 100 of the points are based on T's, whatever your T-score is. That's how many you'll get from 60 to 100. And then in addition to that, if you have any higher education and you want to get into the PN program, we will add whatever is the highest level of education achieved. This is not cumulative, meaning you cannot add 5 + 4 + 3 because you earned an associate's and then went on to earn a bachelor's and then went on to earn a master's. That does not give you 12 total points. You would only receive the 5 points for the master's. So you would add only whatever your highest points are, but those are extra points. So when you go to competing for a spot, you compete then with your T-score plus any of these additional points that you've earned. So what about once you're accepted? Because you apply and then at a later point, we send out acceptance letters and rejection letters. You get both, whether you're accepted or not accepted, both get sent out. So let's say you get an acceptance letter. Well, I haven't started nursing clinicals yet because the acceptance letter comes out in the summer. Is there anything that could keep me from starting in fall, even though I've been accepted? And the answer is yes, because our acceptance is contingent upon certain things. You must maintain an overall HACC GPA of 2.5 or greater throughout the summer until you start your nursing courses in fall. We have had students who have taken courses over the summer, done poorly on them, and dropped their GPA below 2.5. They were not able to start in the fall, even though they were accepted. You must keep your GPA above 2.5 for the entirety until your nursing courses start in fall. You have to be through all your developmental Englishes. You cannot start nursing courses and still be in developmental English. You have to be ready to take English 101. That doesn't mean you have to take it, but you have to be ready to take it by the start of fall. Did you finish or place beyond Math 080? Math 080 is a developmental English, and you have to, in order to start the PN program, either have taken and passed Math 080 or have demonstrated competency to test beyond it through a math test, a math placement test. So you need to be able to show that you have math competency beyond Math 080 or have taken Math 080. And then again, as I mentioned, you have to have finished Biology 121 with a C or better. If you cannot answer yes to all of those questions by the first day of your nursing classes, you will forfeit your admission and you'll need to reapply at a later cycle. Okay, so just make sure you pay attention to things like when we ask you to return your letter of intent and things like that. If you're accepted, we need to know whether you want that spot or not. Because if you don't want that spot or can't take that spot, believe me, there are students underneath you that would be happy to take your spot. So we need that letter of intent that says you're planning on coming so that we can hold your space. Any questions about the PN requirements for admission before I go through the RN?
In order to apply for the program if you're transferring, do you have to have credits with HACC, or can I just transfer credits in?
So if you're saying you took only credits at another university or something like that, and now you're trying to get into HACC?
Right.
Okay, well, just so I can best answer you, was any of those courses you took nursing courses or just like other gen eds?
All of my science, the general education.
Okay, so in those cases where students have all outside credits, they've never taken a course at HACC before. Obviously, you don't have an overall HACC GPA because you've never taken a HACC course before. So then in those rare cases, we consider your GPA on your other transcript. So then we would want to see a 2.5 GPA or higher on your transfer transcript.
Okay, thank you.
You're welcome. Any other questions?
Yeah, I have a question in regards to the T's.
Mhm.
As you mentioned earlier that the version 6 and 7 is out, is that correct?
That's correct.
Okay, and when registering, do we have the option to select which version we need to take? We want
Yes,
to take?
yes, I believe depending on where you register and how you go through the registration process on the T's website, on the ATI website, because you have to register as part of ATI, then you will have the option to select either version 6 or 7, or they'll tell you they're offering only 7 at this site. So then if you want 6, you obviously are not going to take it at that site. You'll have to find a site that offers 6. So you can choose, but you have to make sure you register for the right one.
Okay, all right. I already did my T's last 2 months. So for an individual who scored like 70, and then go for the PN program, and he's been accepted into the PN program. After the PN program, wanted to advance to the RN program and then has the 6th edition of the T's. Do that individual have to retake the T's to have the 7th edition? Because you said from 2023, only the 7th edition will be required.
Yeah, that's a great question. No, if you are a graduate of our PN program, regardless of which version of the T's you took, if you scored a 70 or higher, we would take it. You would not have to retake it.
All right. One last question.
Sure.
If an individual also score like 70, since the RN requires 70 or higher.
Mhm.
And what is your recommendation? Is it to go for the PN program or the RN program?
That's a good question. And I will tell you that's a difficult one to answer. All right. So what I'm about to share here is just generalized information, because what happens is every semester during the acceptance cycle, it varies because it all depends upon who is applying during that cycle. Some cycles we have very, very high level applicants, a lot of them. And then some cycles it's not, the people's T-scores aren't as high. And so the scores vary in terms of typically what's taken at any given time. I will say that some of our programs are more competitive than others, meaning that the students who request those programs, who want to go into those programs, and I'll talk about that later, what that looks like. There are some that are very highly competitive, meaning many, many students want those programs and they score high on their T's. So as an example, our weekend program is a very competitive program. It has for the last 2 admission cycles. No student, just for the last 2 admission cycles, I don't know what this fall will look like, but in the last 2 admission cycles, no student below a T-score of, I believe, 78 has gotten into the weekend program. So that's just an example. If you scored less than a 78 and that was the only program you wanted, you were not accepted in the last 2 admission cycles because there were too many people with higher scores than you that wanted the weekend program. But that's just the weekend program. There are other programs like the 4-semester traditional and the 8-semester and so on, and different campuses even have different competitive levels. Some people like Harrisburg, some people like Lancaster, and so it varies. So I can't say for sure whether a particular T-score is going to be good enough or not. You just need to know that depending on the program and the campus you're seeking, there is a slightly different level of T-score that is usually required to get into those programs.
All right, thank you.
You're welcome.
Sorry, one last question.
Yeah, go ahead and then we'll take the next one. You finish up.
Okay, yeah. Do you still run the stackable? Do you call it stackable from RN? I mean, from the PN program to the RN program?
Yep. That particular program is the one I described where you finish the PN and move smoothly into the RN program. It's called our STACK program, and it is an option if you finish the PN program and want to move into the RN. Yes.
Thank you.
All right. There was another question. Go ahead.
Can you apply to the PN and RN?
Yes,
and can you apply at multiple campuses or just one campus?
No, so we're going to talk about the application itself in just a couple slides, but you may absolutely apply to the PN and the RN. That's perfectly fine.
Okay, thank you.
Yeah, absolutely. So let's go ahead. You go ahead. No. This is for you guys. So you go ahead, and then I'll go.
Yeah, I just want. Do you have to take the T's? Like, so if I'm in the PN program, so I would have to take the T's before August, or when do you have to register to take those?
Oh, that's a good question. I'll talk about deadlines, including T's deadlines, in a little bit.
Okay, thank you.
You're welcome. So if we're looking at the RN requirements to apply, guess what, guys? They look very, very similar to the PN. There's only really 1 or 2 very small differences. So in terms of the RN application, again, did I graduate from high school? Am I 18? Did I finish biology or plan to finish biology 121? Do I have a T-score of 70 or higher? Again, RN takes a 70 or higher. Is my overall HACC GPA 2.5 or higher? If I'm transferring from another nursing program, I just need to do it in good standing. I can't be kicked out because of something. Did I meet with an advisor just to make sure I have all these things? So essentially, guys, as you look at it, note that the only difference in order to apply to the RN versus the PN is the T-score of 70 or higher. Okay, so that's it. If you meet all the same criteria, you can apply to the RN or the PN. It's just your T-score that determines which one. Obviously, if you have a higher than a 70, you can apply to the RN and the PN. If you have a 60 to a 70, you can only apply to the PN. Scores are going to be based on 70 to 100, just like the PN. And there is going to be additional points, same additional points offered for any additional education. So that's how you get your points in order to get accepted. So what about things in the RN application that could keep me out of the fall semester? Same things. Do I have a HACC GPA of 2.5 or higher still? Now, the difference in the RN is simply that not only do I have to be through my developmental Englishes, but I must also be through my developmental math courses. So in the RN, you have to be through both developmental math and English to get in. In the PN, you have to be through developmental English, and you have to have tested or passed Math 080. Now in the RN, you have to be through developmental, which means that you're ready and authorized to take either Math 202, or you are ready and authorized to take Math 103. So that simply means that you have successfully shown that you are college math ready. It doesn't mean you have to have taken those courses. You just have to be ready to take them if you wanted to. Again, did you finish Biology 121? And if you can't answer yes to those, it's the same deal. You're going to forfeit your admission and you're going to need to reapply during a later cycle. So pay attention to your GPA, pay attention to your developmental pathways if you're taking developmental English or math, and pay attention to your Biology 121. Those are the key things to being able to stay accepted into the RN program or the PN program. So what about guaranteed admission? Well, there is such a thing. Guaranteed admission is true only of the RN program, not of the LPN. It's just the RN program. What guaranteed admission means is this. You submit an application to the RN program, and if you meet this certain criteria, we will promise you that whatever campus and program you want is yours. In a sense, you're not competing for a seat. You're guaranteed to get that campus and program. Everybody else that doesn't have guaranteed admission has to compete for the seats based on their points. If you meet this criteria, you're automatically accepted. Here is the criteria, all right? It's all the same things that we've already talked about, guys, with two exceptions. The first exception has to do with the fact that your developmentals and your Biology 121 have to be successfully finished before you apply. So it doesn't mean that you're planning to take Biology 121 in the summer, which would be okay. You just wouldn't be offered guaranteed admission. Or you're currently taking Biology 121. That would be okay, but it's not going to meet guaranteed admission criteria. You must have already taken and passed Biology 121 by admission, and you must already be through all your developmental English and math by your application. That's the first change. The other one, you could be taking those things and still apply. It just means you're not guaranteed a spot, you have to compete. The second difference is the T's. You must have a T-score of 88 or higher to be guaranteed admission. So if you have your developmental English and math done by the time of application, and you have your AMP1 done by the time of application, and you have a T-score of 88 or higher and meet all of the other general criteria, you will be promised the campus and program that you want to attend. Any questions about that quickly before I finish out with what the applications look like? So what about deadlines? You guys brought up deadlines. It's a very, very good question. Again, these are all in the PowerPoint you received. The next admission cycle that we are in is one that we are currently sitting in right now, okay? It is for the summer start. There are 2 programs of all those that I mentioned that start in the summer. Those are our York campus programs, both the York campus 8-semester day and the York campus 8-semester evening start this summer. They are currently accepting applications for those programs, and those applications will remain open until March 14th. The T's cutoff, meaning the last day that you can take the T's and still apply, is March 12th. Okay, so you must take your T's by March 12th, but you can still apply up through March 14th. The application will close at midnight on March 14th, and you will no longer be able to access it. So if you're thinking about the York Campus 8-semester day or evening program, now is the time to apply. You can still apply and be accepted by summer 22 if you have all of those application requirements done. What about for fall? Well, fall is the next time we offer our 4-semester options, as well as some of the 8-semester options. So let's go slowly through this. You can see here that in the fall, we have a couple of campuses, 3 of them, starting our 4-semester traditional program. Harrisburg, Lancaster, and Gettysburg will all be starting a traditional program this fall. In addition to that, Harrisburg will be starting a weekend program. So there are actually 4 separate 4-semester programs that are starting this fall. Harrisburg, 4-semester traditional, Lancaster, 4-semester traditional, Gettysburg, 4-semester traditional, and Harrisburg 4-semester weekend. 4 separate cohorts of students are going to be starting 4-semester programs this fall. There are 8-semester programs that are starting this fall for the evening option. That's Lancaster and Gettysburg. Notice that Harrisburg is missing. We do not have a fall start for our 8-semester evening. Okay. All 3 of our PN programs start this fall. Harrisburg, Lancaster, and York all enroll this fall, and they only enroll in the fall. So if the PN is what you're thinking about, these deadlines are what matters to you. The applications for both the PN and the RN open on April 1st. The RN closes on May 14th. The PN closes on June 4th. And you can see here that the testing deadlines are approximately 2 days before each of the applications close. The reason we delay the closure of the PN program is because in the interim between May 14th and June 4th, we send out acceptance and rejection letters. So let's say you applied to the RN and you did not get in, or you applied to the RN but you ended up getting accepted to a campus in a program that really wasn't one of your first couple choices, and now you're not sure you want to go. Well, you can decline that spot, or if you didn't get in at all, you obviously don't have a spot to decline, but you still have time to apply to the PN program because you still have a T-score higher than 60, and you can still get into a PN program and do that PN to RN pathway like we talked about. So we keep the PN open later to capture any of those students who didn't get accepted into the RN but still want to start nursing in the fall. You still have time to apply to the PN program after that fact. For spring, I just want to show you that feels like a long way away, but some of you may be thinking about spring. Here are the programs that are starting new students in spring. Again, all 3 campuses that offer 4-semester traditional programs are starting them in spring. So we all offer a 4-semester traditional start in fall and spring. And then please note that spring does not start a weekend enrollment, only fall. So if you're interested in the weekend program, the fall is when you need to get in. In the 8-semester evening, we start programs on Harrisburg and Lancaster. Gettysburg is missing this time. Gettysburg has a fall start for their 8-semester evening. Harrisburg has a spring start for its 8-semester evening. Lancaster starts one in fall and spring. So again, pay attention to those if you're thinking about the 8-semester evening. Applications for spring will not start till August 1st. And they will close on September 25th of 2022. Again, the T's deadline is 2 days before the applications close. Questions about any of those deadlines? You must apply by the deadline. Once the deadline has closed, applications have closed. We do not accept applications after the deadline. Okay, so make sure you apply by the deadline. If you want to know where to go to find These links will take you to them. If you were to click this link right here, it would take you to our RN page on HACC. You would currently find a link to a SurveyMonkey application for the summer start. So the only link you would find on this in regards to applications right now would be for the summer York program acceptance, because remember, we're in that window. Come April 1st, if you go to this RN page, you will find a link for the fall program starts. And that's where you can click on it to apply for the fall on April 1st or after. This is a link to the PN page. Same thing, you will not see a link there until April 1st for the application. Starting on April 1st, you will be able to fill out the application, okay? So let me talk quickly about the application and a point that is difficult sometimes to understand, and I don't want you to make a mistake. This is an important section for me to talk to you about quickly. It's basically when you get to about question 12 or 13, most of the application is just what's your name, what's your address, what's your phone number, are you taking or do you plan to take biology 121, what's your GPA, what's your T-score, that kind of general information. But one important question in the application is, what programs and what campuses are you interested in applying to? You can choose as many as you want, okay? It's all on the same application. There's one RN application, there is one PN application, and in that application, you tell us what campus and program you want to attend. You don't just pick one. You can just pick one, but you can pick more than one. You're going to see options for Harrisburg, Gettysburg, Lancaster, 8 semester, 4 semester, weekend. All of that's going to be listed in that question. And you're going to put them in priority order. You're going to say, this is my first choice, this is my second choice, this is my third choice, and so on. What we're asking you is, in that question, you tell us where you would like to go. I only want to go to the Harrisburg campus, and I only want to be considered for the 4-semester weekend. Okay, then just put that as your choice. But I'm also thinking, if I can't get into the weekend, I'm willing to take the Harrisburg 4-semester traditional. Okay, we'll make that your second choice, and so on. So you're basically giving us your priority list of acceptance. Here's the reason that matters. Okay, the reason it matters is because when we start to send people to different programs, when we officially accept people, we do it based on your T-score, or your total score, T's plus those other points, and we do it based on your campus priority list. And so we use your list to determine where you go based on when we get to your name. So I want to point out quickly before I give you some examples, which I think will help clear it up. Notice that some of the options you see are going to be listed as alternates. Alternates are a choice or a list that you are saying you would like to be considered to be put on. It's an actual choice. And if, when we get to your name and your position, alternate is the one that comes up, then you get placed on the alternate list. The alternate list is a waiting list. It means that if clinical space opens because somebody that was accepted can't come for one reason or another, and there is space for you, I take from the alternate list and I put you into the actual clinical program. But until space opens up in the actual clinical program, you are on a waiting list. And if we get all the way to the fall semester and there is not enough spaces available, everybody on the waiting list cannot start nursing in fall. So the reason you choose alternate as a choice is because for some situations, you would rather be on a waiting list waiting for a spot than not get in at all, right? So I say I want the Harrisburg weekend as my first choice. And it's so important to me that I get into Harrisburg weekend that I'd rather be on the waiting list as my second choice before any other program. Okay, you can put that. But if getting into clinical and actually getting accepted to a program is of the most importance, then don't put the alternates as your highest choices, because then you might get selected for alternate when you could have gotten into an actual clinical program. So let me give you some examples of what that looks like. When you submit your application, after all the applications have been submitted and the closing date has come and we have taken down the link, then we take all of the students that applied and we make sure that you met criteria. Somebody verifies that everybody has a 2.5 GPA. Somebody verifies that you have your T-score is accurate and all of those kind of things. So we make sure everybody meets criteria. Once we have everybody that's met criteria, we simply list people from highest points to lowest points. Remember, 105 could be the highest points, 70 could be the lowest points in the RN. We'll just go by RN, for example. So we list everybody from highest points to lowest points. Likely you're going to share a spot with some people that have the same points as you. So what happens is we start at the top of the list and we say, okay, here's the person who has 105 points. Where did they want to go? Oh, they chose Harrisburg Weekend as their first choice. Well, okay, if I look at the Harrisburg Weekend list, I know that I'm accepting 24 students into that program. I have nobody on the list. So this person is going to be moved on to the first name on the list of the Harrisburg Weekend. Now let's look at the second name on the list. Where did they want to go? Oh, they wanted Harrisburg Traditional. Okay, nobody's on that list, and I'm accepting 64 people for that one. So I'm going to put them over on this list. And then we just start shuffling people based on their first choice as we move down through the list. As you can see, inevitably something happens. At some point, a list fills up. Right? The Harrisburg Weekend has 24 names on it, and there's no one else to put on that list because we're only accepting 24 students into the Harrisburg Weekend. So what happens when we come to the name and the person's first choice is Harrisburg Weekend, and I look at Harrisburg Weekend and it's filled? Well, then I look at your second choice and I say, where do they want to go if they can't get into Harrisburg Weekend? Oh, they want to go to Harrisburg Traditional. Well, okay. There's plenty of spots on Harrisburg Traditional, so they get into Harrisburg Traditional. Not Weekend, because that was filled when I got to their name, but they get to Harrisburg Traditional. And then we keep on filtering down through, and then inevitably, maybe Harrisburg Traditional and Harrisburg Weekend is filled. If that's your first and second choice, we're going to look at your third choice. And if your third choice is filled, we're going to look at your fourth choice, and so on and so forth down through your choices. Does that make sense? Does everybody kind of follow how that works? So what happens if you said, I want to go to Harrisburg Traditional, and I got to your name and Harrisburg Traditional was filled? Well, then I look at your second choice. You said, I want to go to Harrisburg Traditional Alternate. Well, okay, I don't have anybody on the alternate list yet, so I'm going to put you on the alternate. And then what happens if your third choice was Harrisburg Weekend and that list wasn't full for some reason? You're not getting into Harrisburg Weekend, you're getting into the alternate list because that was your second priority and Harrisburg Weekend was your third priority. If there is space in that choice, that's where you are going. So that may mean that you get selected for an alternate spot over an actual clinical spot if that's the order of priority that you put it. Any questions about that? Does that make sense? And what happens if you chose Harrisburg Weekend and when we got to you, that was filled? And what happens if then you chose Harrisburg Traditional as your second choice and when we got to that, that was filled? What happens if all your choices are filled up by the time we get to your name? Then you don't get accepted. So that's how you don't get accepted, because your choices were filled by the time we got to your name with students who had higher scores than you and had also chosen those campuses and programs. So you want to make sure you give yourself enough choices that you could actually see yourself attending so that you have your maximum choice of being accepted into a nursing program. Okay, rank them from highest to lowest. And if you want to emphasize getting into a program over a waiting list, then make sure that those actual choices are your highest priorities and the alternates go further down the list. I had a couple students over the years. We got to her name. Her score was an 82, phenomenal score, right? Pretty much could have had her choice of things. Her first choice was an alternate list. Guess where we put her? On an alternate list. And there were spots on all the other programs. Because you told us that's what you wanted. That's why it's so important. We will not make phone calls on the day and say, hey, just so you know, there's an open spot in blah, blah, blah program. Would you rather take that instead? We have hundreds and hundreds and hundreds of applicants every cycle, and we can't be calling and double checking everything. So please make sure you make your choices carefully on the application. It's what we're going to use to assign you to a campus and program. And then you will receive a letter in the mail or through email, excuse me. It used to be through mail. I'm talking like old, but it is through email. And it will say, dear student, congratulations. You have been selected to join the Harrisburg 4-semester weekend program for the fall semester. That's the campus and program you were accepted to. If it's the Gettysburg 8th semester, that's what it's going to say. That is the campus and that is the program that, based on the filtering of the names, you were selected for when we got to your name based on your choices. We will never place you in a campus or program you didn't tell us you wanted to go to. Okay. When you get that acceptance letter, you might be super excited because you got the campus and program you really wanted to go to, or you may find that it wasn't your first choice, or even your second choice, or even your third choice. Sometimes it's somebody's 7th or 8th choice that they get accepted to. So you may be less than excited about that. You have 2 options upon receiving that acceptance letter, okay? These are your 2 options. You can either accept the spot. It may not have been your first choice or your second choice or even your third choice, but you're gonna go to that campus and you're gonna go to that program for at least 1 semester. And as you work through that semester successfully, you can submit a request to transfer. And so what that means is you are asking to move campuses and or programs. I want to move from the Gettysburg 8th semester to the Harrisburg 4th semester. So you submit paperwork that says I want to transfer. If you finish that semester out successfully and we have space for you in the program and campus you want to transfer to, we'll take you. It's space dependent, but you can transfer between campuses and programs as long as space allows. So you can attend for 1 semester and then transfer if you're unhappy with your selection, or you can choose to decline the acceptance, in which case you will not be considered for any other campus or program, and you will have to apply in a future cycle. So that's your only 2 options. You can't email me and say, Mr. Lieb, I know I got into Harrisburg 4-semester traditional, but I really wanted the weekend. Can you just put me on the waiting list for the weekend? And the answer is no, because I already have people who told me they wanted to be on the waiting list for the weekend. So that's already filled. So you can either accept the position and then try to transfer later, or you can decline the position. Those are your only 2 options. I have a little bit to finish up. Does anybody have any questions about anything I've talked about up to this point? Okay, so please just make sure that you are filling out that application carefully when you do. It is important. So here's the dates for when you're going to be notified. All right. Students notified around March 18th, if they are accepted or not into the summer York programs. We will notify you around May 19th for the fall RN programs. We will notify you around June 9th for the fall PN, and about September 30th for the spring. It's about 5 days after the applications close. It takes us about 5 days to verify all the applicants met criteria, to list them, to put them into their separate things, to make sure all our things are in order, and then we send out acceptance and rejection emails about 5 days after. So you will hear within a week and you will get an email one way or the other. All right, final thing I'm going to talk about. Go ahead, Ashley. I missed the name. I apologize. Is it Ashley?
It's
Go ahead.
okay. It's all right. I had a question. If we need help filling out those applications, is there somebody that can help us?
So the person who does most of our application work, his name is Vicky Gensel. I
Okay.
can try to put in her email address at the end. Let's say you made some selections and you were second thinking them and you weren't happy with them or you weren't sure or whatever. If you email her, as long as it's before the application closes,
Okay.
you can change those selections. But it has to be before the application closes. But I can try to get you her email. So if you have issues or problems, you can reach out to her.
Thank you.
You're welcome. All right. Finally, as I talk about it, I just want you to know, okay, so I've been accepted. What are some things I need to prepare for or think about in terms of the acceptance? Well, what I really want to be talking about is things like background checks and clearances and all that kind of stuff. The nursing program, because we take care of patients in the hospital and because our clinical facilities like UPMC and Penn State and Geisinger require it, we must have background checks. Every nursing student must have background checks. You complete them yearly, and there are 3 that are completed every year. There's a PA criminal history records check, there's an FBI fingerprint check, and there's a child abuse history check. Those 3 are done yearly. If you have something that shows up on your background checks, that does not automatically mean that you cannot be in nursing or become a nurse. Out on the website at HACC.edu on the RN page, there is a form or a PDF called Prohibitive Offense Procedure. You want to click on that. The Prohibitive Offense Procedure tells you all about the requirements for the program in terms of if there's something on your background check. Some things the state of Pennsylvania has said do disqualify you from getting a nursing license. And if your charges match anything on that list, you cannot start nursing because you cannot get a license to practice nursing. So we won't let you start in HACC. But there are some things that you might have on your background check that are not on the list, and in which case it won't prohibit you from starting nursing. So take a look at the Prohibitive Offense Procedure. If you have anything on your background check, you will eventually be meeting with the director on your campus, whether it be me or one of the other campus directors, to discuss that. And we'll certainly make sure that we go through all of that with you so that you know what to expect. A physical is required for clinical. Immunizations are required for clinical. I'll talk about COVID here in a second, but immunizations are required. Things like your measles, mumps, and rubella, your hepatitis B, your, tetanus, and so on. So you need to have a physical exam once and done. It gets done at the beginning of the program, and your immunization record needs to be done as well. And if you don't have the immunizations, you have to get the immunizations because they're required by the state of Pennsylvania and the hospitals in order to practice in them. In terms of the COVID vaccination, you can click that link to get immediate up-to-date information in case anything has changed. But as things currently sit, we always have to follow what our clinical sites say. We are their guests in the facility. And so if they say that students have to have the vaccination, we don't have a choice in that. In order to send you to their facility, you have to have the vaccination. So as it currently stands right now, all of the major healthcare organizations in our area that HACC sends to, there may be an exception of somewhere, but certainly the ones I know here local to the Harrisburg campus where I am, all are requiring students to have a vaccination of COVID-19 in order to attend. And if you do not have a COVID-19 vaccination, you must have an approved exemption in order to participate. Facilities have a right to deny the exemption and still say you must have the vaccination. Now that's rare, but there are a couple long-term care facilities that currently are saying we will not accept an exemption. It must be the vaccination or nothing. So what we want to make clear to you is if you do not have the COVID-19 vaccination and don't plan to get it, that's your right. That's certainly okay. But we cannot guarantee you clinical placement. And if we cannot guarantee you clinical placement, you can't be in the nursing program because you must finish clinicals and have somewhere to go to take clinicals in order to finish the program. And if I have nowhere to send you because no place will accept you, you can't be in the nursing program at HACC. So that's just something to think about. That's where we are at currently in terms of the COVID vaccination. Any questions about that? We do a yearly drug screen as well. That yearly drug screen is just to make sure that, again, we are doing everything our clinical agencies require. The clinical agencies require that our students are yearly drug screened. So that's why we yearly drug screen you, okay? Obviously, any positive result on that would be problematic. You would meet with the director. Please note that part in pink down at the bottom. Because the state of Pennsylvania has legalized medical marijuana, but it is not a nationally or federally legalized substance at this point, we cannot accept you into health careers programs, not just nursing, any health careers program at HACC, because to do so puts our federal grants and our federal money at jeopardy. And so therefore, based on that separation between state and federal law, you cannot be on medical marijuana and be in the nursing program at HACC, okay? So what should a prospective student look at when considering a nursing program? It's not just HACC's nursing program that matters. What I want to point out is some of the things you might want to ask your prospective nursing program is the completion rate. How many students that start the program finish it? Because obviously the higher this number is, the better the program is at keeping students in programs and being successful. You wouldn't want to start something you couldn't finish. HACC's completion rate is very, very high, particularly for a community college, which tends to be a little bit lower nationally. Our completion rate is 80%. Most schools hope for something above about 60%. So we are very high in terms of completion. 80% of our students complete within 3 years. You want to ask about the NCLEX pass rates, because obviously you want to graduate the program, take your licensure, be successful, and go on and work. Currently, our RN pass rate is at about 88%. That is in line with all of the other programs in the state. Numbers did dip a little bit. We were higher up into the 91 to 92% prior to COVID, but with the move towards remote learning and some of that, it did take a dip, which we were anticipating just because students were so totally thrown off. Instructors were thrown off. We couldn't do face-to-face clinicals for a period of time. It messed with things. And that's just, to be honest, it messed with lots of nursing programs. However, of course, we are planning to return to campus in summer and fall. So I anticipate that those numbers will begin to increase again as we see a lot more face-to-face interactions. The PNs are sitting at almost 99%. As I said, we have the highest PN pass rate in the state. That is nearly 100% pass rate. The cost matters. I want to point out that cost at HACC may sound like a lot, and it is. $25,000 is no joke. That $25,000 is the cost to start the program with nothing done and finish the program in the RN program. That's not the PN. The PN's a little less than that, but that's for the RN program. That includes tuition, that includes all your course fees, that includes stethoscope and uniforms and everything. Now that sounds like a lot, and I understand that, but here's something to consider. Once you finish your associate's degree at HACC and you go on and get your RN, you will then be able to take your bachelor's degree classes through some other university, and your employer will most likely pay for that. Most of our employers locally are paying for students to go back and get their bachelor's. So for that cost of $25,000, you can achieve both your associate's degree RN and be working as an RN, making RN salary while you're finishing your bachelor's, and then get your bachelor's degree for free, basically, because your employer is paying for it. So you get the benefit of an associate's degree and a bachelor's plus all the money you make in that interim for the cost of that $25,000. That is far less than a bachelor's degree program anywhere in the area, Messiah University or York College or any of them. You're going to pay far, far, far more than that for the price of their nursing degree. So just something to think about when it comes to cost. Job placement, I would say right now our numbers are 100%. The only students who aren't getting hired are the ones that aren't looking. If a student wants to be hired in terms of graduation from any of our programs right now, they are being hired. The hospitals need nurses and you will be hired. You will not have a problem finding a job. Transition into the bachelor's programs, we have agreements with multiple local programs from Millersville and Harrisburg University, York College, Eastern Mennonite, the list goes on and on. There is no problem transferring into a local bachelor's program and finishing your degree, usually in about 15 to 18 months, okay? In terms of the last couple things, again, links are here to the RN page, the PN page, TEAS info, program requirements. All of that is linked right here for you, so you can go right out from your own PowerPoint. That's everything I have for you guys. Any